Am I audible and visible? Let me know. Am I audible? Am I audible? Am I audible? Hello all. Welcome to Unacademy Future Doctors. I'm myself Dr. Dipti Kariya. I'm MD PhD Physiology. I'm Associate Professor and educating MBBS, MD Nursing and Physiotherapy students. And I have more than 17 years of teaching experience. Let me explain something about our subscription. We have two varieties of subscription, one that is plus subscription and second one that is iconic subscription. In plus subscription, you can choose the best from the best. Here, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes. And within 12 months, we are coming with our printed note. Now, second one, that is iconic subscription. In iconic subscription, sorry, just a minute. In iconic subscription, your access to the best from two of the best. Here, which are these two? One that is Unacademy and Prep Ladder with Unacademy. Features I have already discussed, and second one that is Unacademy and Prep Ladder with Prep Ladder. Here, you can have clinical and integrated essential. You can have video lectures from the Dream Team. You can have question bank 3 with active guidance, system tags, and much more. You can have rapid revision, snapshots, treasures, and 2021 dream notes. So you can subscribe from your mobile, either plus or iconic subscription. You can use my code DIPTI10 to get 10% extra discount. Special class has some features which we have added. These classes are interactive live classes. You can attend the live class as well as you can participate in the live chat. You can raise hand. You can talk to your educator during the live class and get your doubts solved. You can also have polls for the learners. You can never miss a class. You can get notification regularly. And lecture notes are also given. You can download lecture notes as well as get access to the recorded session. And you can attend live classes and participate in the live chat and get your doubts clear. Plus, as I told you, we have updated and highly effective question bank, which is having more than 25,000 high yield clinical questions. These questions are based on latest exam pattern plus all the description explanation. These are our NEET PG 2021 toppers. This is our exam schedule for December 2021. You can see here regularly on every Wednesday, on Friday, Saturday, we have different exam schedules. As well as we have FMGE 2022 comprehensive batch that already has started from 15th December for 6 months, and target NEET PG 2022 test and discussion batch also started from 15th December. Duration is for 3 months. Another announcement is we have our NEET PG compact. That is, write down the date 19th December at 5 p.m. Here you have to crack 45 questions in 60 minutes. This live test is available on your Android as well as web. These questions are created by our top educators. Questions are from community medicine, ENT, and ophthalmology. That is part 1, MBBS third year MBBS. Along with that, we will give you detailed video solutions by our top educators. You can get real-time All India rank, as well as you can practice and enhance your preparation. Along with that, we have a scholarship from a pool of rupees 10 lakhs plus top 50 participants get a chance to win Amazon vouchers up to rupees 10,000. First three rankers, they get 100% scholarship, 4 to 10, 75%. 11 to 50 gets 50% scholarship, and 51 to 200 gets 25% scholarship. So enroll now free, and that you can use with my promo code Dipti10. So you can boost your medical PG preparation with us. Here, these are the subscription charges for plus as well as iconic subscription. Longer the duration of subscription, cheaper are the rates. Now, we'll start our today's topic. Let me tell you one thing, that is all these classes which you watch on our platform Unacademy Future Doctors, as well as special classes. We have our special classes on the app. These classes are also free to access. Tomorrow only I have my special class, so you can access the class. This class is free. You need not have to subscribe for the same. Okay. Now, today's topic, one of the important topic for clinical aspect, the work of breathing. Now, what is this work of breathing? As we all know, during respiration, two processes are there, inspiration and expiration. Okay. So mainly during inspiration, as I told you, inspiration is an active process. So during this respiration, uh, for entry of the air, there is change in the volume of the thoracic cavity. And for change in the volume of thoracic cavity, there is contraction of respiratory muscles. So work is required to be done. Okay, so here today we'll discuss about the work which is done during normal respiration as well as during forceful respiration, during different diseases, which different work of breathing is increased. Okay, this is one of the little bit tough topic to understand. Okay, now, so work of breathing normally during normal quiet breathing, when we are sitting here ideally and breathing, normal quiet breathing requires 3 to 5% of our total energy for this work of breathing. Okay? And during exercise, it may rise up to 50%. You can see 10 times this work increases. Okay. Now, so work of breathing means we require work to overcome resistance. Now, which are this resistance? So, resistance to the breathing. So, this is resistance offered by three things in our respiratory system. One, that is elastic resistance. Okay, elastic resistance, also known as compliance work. We will discuss. Second is viscous resistance, and third is airway resistance. We will discuss one by one. So, first is elastic resistance. This elastic resistance is again by two forces. One is by tissue forces, like our lung tissues, they have smooth muscles, elastic fibers, collagen fibers. And second, that is surface tension. We have discussed surface tension increases the tendency of alveoli to collapse. When alveoli collapse, we require work to open those alveoli. Okay? So elastic resistance is due to two things. Number one is by tissue, and second, that is by surface forces. And this elastic resistance is also known as compliance or distensibility. Hmm? Second is non-elastic resistance. Non-elastic resistance includes your airway resistance and viscous resistance. Okay. Hmm? We will discuss one by one. So here you can see. So first we discuss about airway resistance. Airway means our air passages. When air passes through passages as well as to the alveoli, there is resistance. And this resistance depends on various factors. They are mainly four factors are there. Number one is rate of flow. Okay. Second is radius of the airway. Third is length of the airflow. And fourth is type of airflow. Try to remember all these four: rate, radius, length, and type. So rate of blood flow, if the rate of blood flow is more, then resistance will be definitely more. So rate increases, resistance increases. And this rate is highest in intermediate size bronchi. Intermediate size bronchi. So here resistance is also high in this bronchi. So one, that is rate of gas flow. Second factor is radius. Radius is very powerful determinant of resistance, as resistance is inversely proportional to radius, fourth power of radius. So radius increases, definitely resistance decreases. Okay, and radius decreases, resistance increases. This is the reason why resistance is more during expiration. Why? Because during expiration, what happens? Radius decreases in the air passages. Okay. Now, this airway diameter is also affected by so many other factors, like sympathetic stimulation causes dilatation of bronchi. Acetylcholinergic causes constriction of bronchi. Okay. So because of this also, there is change in the radius changes, resistance changes. So first factor, as we have discussed, that is rate of flow. Second factor is radius. Third factor, that is length of airway, that will not change. Okay, most of the time. Length of airways. And third is type of airflow. Air or blood flow has two types. One is laminar flow, or it is known as streamline flow in same straight stream. And second is turbulent flow. When this air passes through constricted opening, small, this becomes turbulent. So when it is turbulent, then resistance will be more always. Okay. Now we discuss about components of work of breathing. So as I told you, we have three resistance. So work is also done to overcome this three resistance. Okay. So which are three resistance? One is elastic resistance. So work done to overcome elastic resistance. Okay. That is also known as compliance work. This is 65%. You can see here, this is the diagram for work of breathing. You can see here, this much is compliance work. This is whole, this much, to overcome elastic resistance. Then work done to overcome viscous resistance, that is least 7%. This one here, this one. I'll show in the other diagram also. And third is work done to overcome airway resistance, that is 28%. This remaining one. So you can see here, this is the work done to overcome this three resistance. You can see here, as I told you, this is compliance work, work done to overcome elastic resistance, this one. Second, work done to overcome airway resistance, second one. And third, work done to overcome, second, work done to overcome viscous resistance. And third, work done to overcome airway resistance, this one. This is viscous, this is elastic. You can remember here. EVA. So EVA is your mnemonic. You can remember here. Elastic resistance or compliance work, viscous resistance or tissue resistance, and airway resistance. Okay. Now, during quiet breathing, when we inspire, all these three resistance are there. So whenever you are drawing this work of breathing diagram, here you can see this diagram, there is change in the lung volume on this axis, and here change in the pleural pressure. Okay, so here change in the pleural pressure and change in the lung volume, and you have to draw this diagram in this way. Okay, now, so during inspiration, work done is to overcome all the three resistance. Which are those three? Work done to overcome EVA. I gave you mnemonic EVA. Elastic resistance, viscous resistance, and airway resistance. Okay. Now, in quiet breathing, now we discuss about work of expiration. So quiet breathing, that is passive process. So your elastic resistance will be 0. Okay. So here, this is the work done to overcome this two resistance only, and they are airway and viscous resistance. So work done during expiration is to overcome viscous and airway resistance only. Okay. Now, we discuss about work of breathing in various lung diseases. You can see here, this is normal diagram. So what happens first in restrictive disease? When restrictive disease is like lung fibrosis, what happens when there is fibrosis of lung? Elastic tissues are reduced. So which work is increased? Elastic resistance work or compliance work. So you can see here, this one, this is normal. And this, you can see this compliance work, this one is increased. This one, you can see here compared to this. Am I clear? So during inspiration, this work is increased. Which work? Elastic resistance work. Okay, because the elasticity is reduced. This is so easy. Okay. Second is in obstructive disease. Here what happens? You can see here, this is normal lung work of breathing. This is obstructive disease. Here in obstructive disease, what happens? Because there is obstruction. So air passages are obstructed. So what happens? There is increase in the airway resistance. Person has to do more work to expire. So during expiration as well as during inspiration also, respiratory muscles, they have to perform more work to overcome. Not this resistance is same, you can see compliance more or less, but this one will increase, and that is airway resistance. Okay. Okay, so this is your work of breathing in obstructive lung disease. Now, next is factors, they affect total work of breathing, both elastic, viscous, and airway, all the three. That is increase in the respiratory resistance or decrease in the compliance. Okay, so when the resistance increases and compliance decreases, both the things, that results in increase in all these three works. And there is another is also there during exercise also, you can see work of breathing is increased. Okay, because during exercise more blood flow is there, but respiratory system or this lungs, they have to perform more work. As I told you, it becomes 50%. Normal work of breathing, that is around 3 to 5%. Okay, so this is all about work of breathing. This is all about today's topic. Thank you. If you like my video, you can like the video, you can share with your friends, you can subscribe our channel Unacademy Future Doctors.